Jaw tightness or issues opening the mouth can be called trismus or lockjaw. There are various reasons this can happen, such as after surgery or radiation for head and neck cancer. My name is Kelly. I am a physical therapist that specializes in oncology and lymphedema. In this video, I'm going to share 3 exercises to reduce jaw tightness. Plus, I will share a bonus exercise option. Before we begin, make sure to subscribe down below for weekly new videos. You can also check us out on our website or follow along with us on Instagram for more related content. So these are exercises or treatments that a physical therapist or a speech-language pathologist may complete for someone with trismus or lockjaw. They shouldn't be done unless cleared by a doctor for safety, just to rule out any contraindications or precautions. But let's get into the exercises. So the first is to work on opening the muscles. We want to open up the mouth as wide as possible, holding for about 5 to 10 seconds, and do this about 10 to 15 times. We can try to do this with and without trying to keep the tongue on the roof of the mouth by just opening up as wide as possible. So by opening up the mouth, dropping the lower jaw, we can just have it open, holding for 5 to 10 seconds. Or we can try using our hands to gently pull down for overpressure. I would highly recommend using a sterile glove so you don't put bacteria or bring bacteria inside the mouth when doing that. So let's show a few for an example. One of the main muscles that can be tight is the masseter muscle, which runs kind of below the cheekbone, down the side to below the jaw. And when this muscle is tight, it's going to be a hard time to open the mouth. So we're trying to gently stretch out this muscle. We can even, as we do that exercise, gently massage into this muscle. So if we open up and then take your other hand and gently massage it, that can try to help release that muscle tension, just like you would anywhere else in the body. The next exercise is to work on shifting left and right with your lower jaw. We can do this 5 times, holding 2 to 3 seconds on each side. I think it's best to focus on keeping your head forward by looking in a mirror or staring at a spot in front of you to make sure that you're not moving your head with it. You can do this 10 or 20 times, and I'm just going to show a couple for an example. If you want, you can also give a little bit of overpressure, again, making sure that we keep everything in a line and using the muscles in your face as well. And the third exercise we're going to show is our jaw circles. This is a functional movement because it mimics the motion of chewing. So start to make large circles with your jaw by trying to think about chewing gum or food. Just be sure to exaggerate that movement to get as much range of motion as possible. We can do 10 to 20 circles in each direction. Again, as funny as it may look to watch yourself in the mirror, sometimes it's really nice that you can get some feedback just to make sure that you're getting as much range of motion as possible. All 3 of these exercises can be done 1 to 5 times a day throughout the day, as long, again, as someone is cleared medically. Now, for the bonus option, a doctor or therapist may prescribe a medical device like a TheraBite or a Dynasplint. These are tools that can help provide a stretch to the jaw to help open up the mouth. Sometimes even tongue depressors stacked are used as well. The medical device can be slowly increased and measured to a specific opening to encourage stretching and to provide some gentle overpressure to that stretch. The tongue depressors are also used by slowly adding one or so each day or every few days as tolerated to slowly increase the stretch level as well. These are held between the upper and lower teeth or gums. The goal is to hold for at least 30 seconds, but when someone is starting out, they may want to start closer to 10 seconds just to make sure that it's a comfortable stretch. With the tools and the stretches like these, one can help treat trismus and LockJaw. Now, if someone has swelling or lymphedema in the area, there are other treatments that may also be done, which I do talk a lot about in other videos on my channel, which I encourage you to check out. But those are the main exercises to help reduce jaw tightness from trismus or lockjaw. Be sure to work with a physical therapist or a speech-language pathologist in your area for more personalized guidance. And if you'd like to see any other topics in a video, feel free to comment that down below. Thanks, everyone.